Welcome to the Subcommittee on Issues Relating to the Support for Persons with Disabilities. This is the 8th meeting as well as the last meeting. I welcome representatives from the government to attend this meeting. Agenda Item 1, Enhancement of Interorganizational Information Sharing in Relation to Services for Persons with Disabilities. Please refer to LC paper number CB-1 700/2025-01. Let me invite Undersecretary for Labour and Welfare, Mr. Ho Kai-meng, to walk us through the administration paper. Members who would like to speak, please press the Request to Speak button. Over to you, Mr. Ho. Thank you. This paper briefs members on the current situation and the strategic direction and the enhancement of interorganizational information sharing in relation to services for PWDs. At present, data relating to elderly persons as well as PWDs and their carers are scattered in the systems of different government departments, public organizations, and NGOs. On the premise of protecting personal data privacy and ensuring technical feasibility, enhancing the integration of these data can improve the efficiency and standard of services for elderly persons and PWDs as well as their carers. eHealth is a territory-wide eHealth record-sharing system launched in 2016. In the policy address of 2023, the government launched the initiative to roll out a 5-year development plan of eHealth Plus to transform eHealth into a comprehensive healthcare information infrastructure that integrates multiple functions of data sharing, service delivery, and care journey management. Apart from healthcare providers in the public and private sector, residential care homes for the elderly as well as for the disabled, and social welfare organizations could also register with eHealth. In fact, some of the RCHs and social welfare organizations have already registered with eHealth. eHealth allows them to have a better grasp of the health conditions of elderly persons and PWDs. So we encourage organizations to participate in eHealth. Medication management is a crucial part of the treatment process for patients. The government collaborated with the Logistics and Supply Chain Multi-Tech R&D Center to launch the e-medication RCH project last year to support RCHs and their e-medication management system providers in connecting with eHealth. This reduces the reliance on manual copying of medication information and streamlines medication dispensing and management, as well as enhances the dispensing efficiency and medication monitoring. It also reduces the risk of medication incidents. The CE announced in the 2024 policy address that the government will explore the setting up of an interdisciplinary and inter-organization database on carers of elderly persons and carers of PWDs for the detection of high-risk cases for early intervention. The data will preliminarily come from the hospital authority as well as the health department as well as the housing department. We're working with the Office of the Privacy Commissioner to see how we can meet the relevant requirements. We're collating data from different databases to meet the requirements and launch a pilot scheme. Moving forward, we will continue to explore how we can enhance data sharing among social welfare organizations and the government to enhance cross-sector and cross-organizational collaboration for timely intervention so that we can provide appropriate support and services for people in need. We welcome questions from members. 4 members have asked to speak. I'll give 5 minutes for each member, questions and answers inclusive. Dr. Teck Chi-yun, please. I'd like to ask about the database on carers. We've discussed this on different occasions. We hope the government will implement the database soon. According to the paper, the government will borrow data from the SWD, the care teams, and the housing department, as well as the relevant residential care homes for the elderly and the disabled. This might be a complicated procedure, but the government should start moving first. I believe there's enough manpower from the government to work on this. I'd like to follow up on the government concerning the implementation. I think it is great that the government tries to ensure early intervention of high-risk cases. But how do you define high-risk cases? Based on the age of the persons involved or the medical report, there could be a long list of high-risk cases, but they may not fall under the definition of high-risk cases. So is there a definition for high-risk cases so that there is a standard that we can comply with as we draft the list? Also, I appreciate the government that it tries to come up with a system that automatically prompts the organizations to contact the care recipients involved in high-risk cases. But how does the mechanism work? Take the emergency alarm system as an example. The alarm system will go off when there are incidents. In the mainland, there are call centers that help monitor patients in taking their medication in a timely manner. Apart from the system, you need support services such as medical services. There needs to be a support system in the district. Without such services, the system won't work. So I want to know how the alert system will work. Also, will there be KPIs? What kind of goals do we want to achieve within, say, a year? We want to have an assessment system or evaluation system, say, a year after the mechanism is launched. We want to ensure that the people involved in high-risk cases could be taken care of. Mr. Chen, Commissioner for Rehabilitation. I thank Dr. Chick for the questions. On high-risk cases, we consider carers as well as carers of elderly persons. We also include low-income carers. We may expand the scope in the future, but we want to have a start first. As mentioned, we will work with the Office of the Privacy Commissioner. Some of the data is not for social welfare purposes. So once we get the permission to use the data, things will get much easier. There are still technical problems that we'll have to be dealt with, but once we get the green light, it will be a lot easier. On automatic detection, we are testing out a few things. We want to achieve this. Say there is a carer or an elderly carer who needs to be admitted to the hospital. And when the hospital authority is aware of this, can we be notified so that we can reach out to NGOs, care teams, or social welfare organizations to see whether the care recipients are getting appropriate support at home? So we want to have automatic detection of these cases. There are households with elderly people taking care of PWDs. This is already very tough, and when the carer is admitted to the hospital, the risk will go even higher. So we take this matter very seriously, want to implement such a system to detect high-risk cases. Dr. Tate mentioned about emergency alarm systems. There are different organizations that make use of, for example, sensors to see if elderly people or the disabled encounter any other types of difficulties. So there is room for us to consolidate these services. We will look into this. And also, as said, when there's an increase in risks, we want to be able to detect them. In terms of KPIs, we will evaluate the level of difficulties after we've launched such a system. We will consider the effectiveness of the system, but it might be too early for us to assess this now. I thank the Commissioner. We have a much more concrete discussion now. I think we need a timetable. We should start with the easier steps first. I hope you can tell us when you will launch this system or database. If you don't have a timetable now, please provide a written reply afterwards. I think we have to have a pilot scheme first. In terms of how big the database will be, I think we have to first launch it to decide on that. Professor William Chen. I support the launch of the database on carers to enhance data sharing. The relevant work has been quite slow, especially in terms of building the database. So what is the latest progress of the government building the database? What are the major difficulties and challenges? Dr. Tick and I are very concerned about the timetable for launching the database. Without a timetable, it will just be an empty talk. You need to build the database step by step, so a timetable would be crucial. Also, RCH for the elderly, the disabled, as well as social welfare organizations, how are they participating in e-health, and how is the government encouraging these organizations to make use of e-health to have a better picture of the residents' health conditions? Also, how can they make use of e-health to reduce the risk of medication incidents? Commissioner, please. I know you all want to see the database. We have to first deal with privacy issues. The data will come from different departments, such as the housing department, and the data is not supposed to be for such a purpose, so we have to get the consent from different parties to use the data so that we can meet the requirements under the Personal Data Privacy Ordinance. With these restrictions, we'll have to see how we can work around the existing rules. So this is what we need to work on now. After taking care of the privacy problems, we have to deal with the technical details. We have to see how long we can use the data for and how we can store the data. The government has done a lot of work in terms of data sharing, so the technical parts would be easier. Therefore, we have to first deal with the statutory requirements in relation to using the data. It's never easy to make the first move. I understand that you need the consent. You have to coordinate the different organizations, and I believe this is doable. That's why I said you need a timetable. Can you tell us when you'll be able to achieve this, say within 1, 2 years, or 3 years? I just need to know the progress. It's not just about signing a consent form. It's not as easy as that. Our colleagues have been working on this. Say, for example, an elderly person is admitted to the hospital, and the person may need support from social welfare organizations, and we have to ask for the person's consent, whether they want the data to be shared with the organizations. Not everyone would give us the consent. We will ask for the consent, but this is not the long-term solution. So if we can get the exemptions under the existing ordinance, it will be much more efficient. I cannot give you a specific timeline now, but all I can tell you is that this is what we're working on. We are trying to deal with the privacy issues, and we're trying to launch a pilot scheme. Once this is done, things will be much easier. Say, for example, if we can have the data from the hospital authority, it will be much easier. In terms of the size of the database, it could be flexible. We have to first deal with the privacy issue. We have to deal with the connection or connectivity problem with the hospital authority. Then we can assess the effectiveness. And then we can decide on whether the workflow is effective.
嗰個同意機制。
We now have a simplified consent system under eHealth. Can we learn from that sort of streamlining? We do keep an eye on that. There's an ordinance governing eHealth, so we cannot simply replicate everything unless we draft a new ordinance from scratch, but that's not the approach we have in mind. Under the PDPO, there's room for work to be done. I'm suggesting this for discussion. You can streamline things between departments, and then you can help people in need. Seniors know little about how things work, so if government departments can break down barriers between them, that would be easier. Say at the hospital, patients are worried about your access to their medical details, but you can tell these seniors that you are sharing their information with social welfare organizations offering them care. So let's get rid of silos. Currently, practice varies from one organization to another. That's why you have all sorts of problems. I should make myself clearer. We are on the same page with our hospitals. When the hospitals ask patients for sharing consent so that the data can be shared with social welfare organizations and then we can give the patients better care, quite a number of patients refuse to give consent. It's about how you put the question to the patients. Patients think it's about their privacy. You can put your question differently and you can get a different results. I think I get where the member is coming from, but that's not exactly how things work. Assistant Director. I want to tell members something about how care homes help their residents sign up for eHealth. Now, there are care homes subvented by the SWD. Most such care homes have signed up for eHealth. Towards the end of the COVID days, we encouraged care homes to register for eHealth at the institutional level. The groups running the care homes had to register, and then the care homes had to register, and then the residents had to register. There are geriatric assessment panels and visiting medical officers going to those care homes. Those doctors and assessment panels look at the residents. They provide health checkups. When visiting doctors see something in the medical records of the residents, that's very helpful for the work of such visiting doctors. So we encourage care homes to sign up for eHealth. Those care homes also see the merit of signing up. We haven't compiled any official stats on whether every care home has signed up, but from what we know, signing up for eHealth makes life easier for care homes because that will give visiting medical officers easier access. So I believe most care homes have signed up. So that's for seniors staying at care homes. Just then we were talking about people in the community. So we start with care homes. We want those residents to sign up for eHealth. And then we explore the way forward. That's all for me. Mr. Bill Tang. Thank you, Madam Chair. We have the Commissioner here. A couple of months ago at the panel on welfare services, we had a discussion about a database for seniors. So are we talking about one and the same thing? Is it the same team working on the same project? And we're simply talking about the database, or rather, the focus being on PWDs this time, whereas back then we were talking about seniors. Are we talking about one and the same thing? If it's one and the same initiative, are we going to see tangible outcomes this year? Are we going to see something concrete start this year? A pilot will do. Maybe it's a specific district, a particular demographic group, a specific age group. Or are we starting with a particular government department? We're still being told about the privacy problems as a hurdle. This is not an infrastructure project. It's not like you tell us about the site investigation and then the piling and then the foundation, and then we are given the progress in percentage terms. The matter at hand is simply how the government interprets an ordinance as to what is compliant, and we don't see any result. I find that frustrating. One thing got me wondering. The government said the hospital authority tried asking each patient. So my impression is the government does not want to ask each and every patient. You want a blanket approach. What is taking you so long? Every time we were told about privacy issues holding us up, we don't have an ongoing case of judicial review holding up the whole thing. What is holding up? What is holding up the process? What is taking so long? Why not have a pilot? Why not start small? Is someone within the legal division of the hospital authority holding things up? What is holding things up? And it has taken so long. This is not an infrastructure project. I wonder what is taking so long. Now, I would be happier if the government could tell me that we could see something concrete this year. Now, assuming this database is completed, who will be able to access the database? How do we make good use of the data in the database to offer good support? We may have the support in place, but what kind of services can we expect? So can the Undersecretary or the Commissioner tell us more? Undersecretary. Before the Commissioner tells us more, I want to say a few words. Now, we are talking about one and the same initiative. Now, we want to be able to use the data already provided without having to secure consent once again. We're trying to find a way within the framework of the ordinance, as Mr. Bill Tang will know from his experience in district work. District level workers are happy to offer help, but that help may be spurned by people due to various reasons. As the Madam Chair will be aware, some people are not willing to share their information. They are not willing to receive visits. So we have to find a way where we can use the data without having to secure the consent, especially when it's a life and death matter. We need to find something that gives us this overriding power. We have been working with the Department of Justice and the legal team within the hospital authority. We need to find an approach that every party is comfortable with, and that will take time. That's why a month ago we discussed a similar matter at the WSP. It will take time to sort out the legal obstacles. Now the commissioner can tell us something else. Mr. Chen, it's been a month. Any progress? This matter has been under discussion since a long time ago. The Privacy Commissioner has been very helpful. They have been helping us with the design, with the direction. I cannot commit to anything, but we will be able to show members something within the foreseeable future. So, do we have a timeline when you say soon? We will be able to show you something this year. Ms. Chen Haoyan. Thank you, Madam Chair. I have a question about a scenario. In Shamshui-Po, in Meifu Sanchun, in the state I serve, I got 2 cases in a row involving seniors in their 70s and 80s. One had a knee surgery. When this senior got discharged, the senior said they could return home where they stayed with the domestic helper. But the hospital did not check the records and sent the senior home. But the domestic helper left before the senior returned. The carer was out of town at the time. The family members were out of town. This senior could not leave their bed because of the knee replacement surgery, and this senior called my office. The SWD did everything they could to reach someone to get help for the senior. So in this case, a senior simply said they had a foreign domestic helper at home, but things may change. So I would like to see automated monitoring in your future system. But the problem is the carer may be a foreign domestic helper or a family member. You will be able to find the family member who is a carer, but you cannot keep track of this foreign domestic helper. Still, this senior had a fall at home, and then the following day, an officer from the SWD arranged hospital admission for this senior. So, will the future system be able to offer automated monitoring? Many seniors live alone. In Meifu Sanchun, many seniors rely on their FDH. Some are very helpful, but other domestic helpers leave when the senior is hospitalized, so we have to find a way to sort out these cases. I want to highlight the cases where seniors live alone or they simply live with a foreign domestic helper. Now I turn to persons with disabilities. Some have rare diseases. Some have a problem with their spinal problems. Each time they have an attack, they lose their vision. They cannot move. Medical evidence shows women are particularly vulnerable, and their babies suffer when these women give birth. Some carers are at a higher risk than others. Some such attacks come even only afterwards. The person suffering from the attack may lose their vision, they cannot move, and they have to look after their baby. I know it's hard, but we have to distinguish between the needs of different carers. The vision of such a PWD may deteriorate over time after each hospital admission and discharge, so you need to make such a note in your future system.
Commissioner, I thank the member for the information. The first case shows that we cannot just rely on the consent made by the patient. We have to also rely on the data we have. But as to whether we would be able to get the details in terms of whether their domestic helpers are available, we'll have to decide on a case-by-case basis. We may be able to, for some cases, arrange for staff to check on the elderly person. With enough communication channels, we'll be able to deal with such situations. On whether we can have definitions or groups for different types of cares, we can first collate the data we have, then we can offer the support services for those in need. Say, for example, a carer is admitted to the hospital, and after we're notified, we can reach out to the social welfare organization to offer help. With the data from hospitals, we can, in a more precise and targeted manner, see what kind of families or households require our support, and we can provide the support in a more targeted manner. Before we have the carers list, say for singleton households with just the support of domestic helpers, can you do something to offer support to these households? You cannot just let these singletons be discharged from the hospital. If they are left alone at home, it could be very dangerous. They may die without anyone knowing, so is there a mechanism in place before you have the list ready? The hospital discharge team has been communicating with the relevant party. Well, we didn't even know that the domestic helper was away. Well, we have a communication mechanism in place now. The problem is when a patient says that he or she has enough support, we have to see whether the self-assessment made by the care recipient is accurate. Next, Ms. Doreen Kong. Madam Chair, I'm happy to see that the government is making a further step. We don't have a timetable yet, but according to the administration, they'll be able to show us something within this year, and I'm happy to hear that. I have a personal opinion. Say we take the first step and we come up with a list first. The help offered by the list may be limited. I do not just want a list or a table. I want to know what kind of services will be offered. I know that there is a platform for carers now, which is great. I want to know if the platform can be connected with the list to be drawn up. In other places, there are assessment services. You need to have an assessment mechanism in place to decide whether a case is of high risks. Say you have a high-risk case, then you can offer personalized or customized services for the case. You can work towards this direction. I'm just thinking that if there is a list, how can you decide, for example, whether the cases are of high risks? There needs to be, therefore, an assessment mechanism. And who will you share this database or list with? This is crucial. You have to decide how you're going to make use of the database. Who will have the right to access the database and what will be the database used for? According to your paper, data will be from the care teams, the SWD, and the housing department. Is this enough? I have a suggestion. In Australia, a bill has recently been passed called Age Care Act. It is a new bill. Personalized service in Australia is a right. There is an assessment system under the law, and there is also a database. So this is just an information for the reference of the administration. I want to know if there will be services in place to encourage people to offer their information to you. Say you have an assessment system in place. How can you update the information in the database? Commissioner, please. I thank the member for giving us the information about Australia. We will include information of households with PWDs taking care of elderly persons or households with seniors taking care of PWDs because these are considered as high-risk cases. We will also include low-income carers as well as low-income households in the database. We are not adopting the same approach used by Australia. Say for PWDs, we already have an assessment mechanism for them. Same for elderly people. So we will extract the data from the existing assessment mechanism and include them into the database. So information to be included in the database will all be from high-risk cases. There are people with greater needs, and when emergency happens, say someone is admitted to the hospital, the risk will be even greater. And under such circumstances, we can have the justification to get the data under the Personal Data Privacy Ordinance. There can be different types of services. Once we have the database ready, we can offer the different types of services. Say someone is admitted to hospital and we get notified and we can see what kind of support we can offer. Well, it's great that you will come up with a table which includes information of households with TWDs taking care of elderly persons. Are you going to have a chat bot making phone calls to these households regularly? How are you going to make use of the data you get? Well, we will have information of high-risk cases in the database. Say carers or care recipients are admitted to the hospital. We will get notified by the hospital authority and we can take the initiative to follow up on these cases. This is a kind of service that we can provide. Of course, with the database, we can introduce new services. But first, we'll have to have the database ready. We'll have to get the exemptions under the existing ordinance. Then we will get the database connected to that of the hospital authority. We can expand the database if we want. We want to include elderly carers as well as elderly care recipients as well as low-income carers. and low-income care recipients in the database. We also want to include those with rare diseases in the database. We can expand the list if we want in the future. Next, Mr. Andrew Lam. Well, a number of members have spoken on the database. I agree that this is the direction that you should take. I also see the effort you have put in. I want to talk about this from a different perspective. After you've built the database, how are you going to make use of it? I hope the government will be able to come up with a complete database but service provision is another topic. Nowadays, there are many people on social media. Say I can go online and look for a recipe. I type in recipe and I'll get a lot of information. I see that the Undersecretary is smiling here. Can we get service providers to reach out to people in need? Service providers may not have enough information they need, not to mention service recipients. We can think of a different way to share data with the service providers. The government as well as service providers can, through a platform, provide information to the relevant parties. It's not that the government should first collect all the data it needs. There could be a data sharing platform. I hope you can start working on this. We have big data analytics, and we've been making use of this technology. How can we use this technology to build such a platform? I want to hear the administration about this. Commissioner, this could be feasible. We have developed a carers platform. The platform includes all kinds of services for carers. The platform has been launched for a year or two now. With more carers knowing how to use this platform, well, we can expand our marketing efforts. We hope to promote information relevant to carers. This is not what we are focusing on at this stage, however. This is because the platform has just been developed recently. We are focusing on how we can update the information on the platform regularly. We are thinking of how to provide greater convenience to users. With more people making use of this platform, we want to be able to provide the information most relevant to users. There are different digital marketing strategies we can use. We want to provide information to users in a more targeted manner. This is what we are trying to work on now. For the database on carers, we may not need the specific personal information. Say, if we know that there are certain people in need in, say, a housing estate, it would be very helpful already.
嗱，咁即係
One comment. It's good to see the government taking this initiative forward. You need to dedicate resources to such publicity. If you have the resources, please stay focused on such promotion. Now it's my turn. Now we're talking about a carers database for persons with disabilities. So I'm focusing on the chronically ill and PWDs. The Commissioner has said this time and again. The government has been struggling with gathering data. In a hospital, there are medical social workers, and then there are discharge support schemes for seniors, and then you also have allied health professionals. Those professionals check with patients to be discharged about any welfare support they may need. There weren't many problems with those steps. But now, coming to the database, the Commissioner told us about the struggle with getting patients' consent. Where does the problem lie? Is a particular department holding up the information? Which side is struggling? Now, on the database, are we talking about a system like the CMS system with the HA? You enter the password and then the stakeholders can access the information of patients. How will the system work? We have been discussing this on multiple occasions. So my impression is this system will look like an Excel spreadsheet. How would it work? How can we share the information with those who need it? Now I turn to privacy. Now we have been giving support to carers, and now we're discussing a database. Privacy has been an obstacle for a while. When can we see progress? Are there things we're already trying and we're simply waiting for results? Now, on gathering data for the database, some people wonder if the government has any new ideas. But we have been focusing on people on a low income. Can we work with the housing department? Say when you see no movement in someone's water meter or power meter, can we reach out to those families? Those households may need help. Can we have some new ways of not just gathering data, but also helping those socially withdrawn families? For the carers database, sure, the priority goes to high-risk carers. But let's not forget people with rare diseases. There are hundreds of them. They are PWDs. A member cited the example of someone with neuromyelitis and optic nerve issues. Those people have multiple attacks throughout their life, with the first onset in their teens. The first onset may be a fracture, the second time loss of vision, and then the third time people may get mobility issues. So as a next step for the database, we should include patients suffering from rare diseases and their carers. Before the Commissioner comments on this matter, I want to say something. At the HKCSS, we held a seminar 2 weeks ago. At the seminar, we had representation from the social welfare sector and the tech sector. Many ideas were proposed. For us, as the government, we have to set the priority. People who are most in need when their lives are at stake. The people with the greatest need are not willingly giving the data. Those at the greatest risk are those who need help, but they are not aware that they need help, whereas those who willingly share their details are not at the greatest risk. So to go back to the example of the member where a senior with a foreign domestic helper at home, they thought they were fine. And that's what we're getting at. We're trying to find an approach where we don't have to secure the patient's consent as an extra step, and we can find a way to alert us when this person needs help. Say, someone's hospital admission may be a sign. We want to be able to see such cases, and that's what matters. Of course, a water meter's movement may be a sign. It may take days before us we can tell someone is in trouble when you don't see any movement in someone's water meter. For us, we prioritize cases when someone's life may be at stake, especially for people who are not aware that they need help and they're not willing to share the details. Now over to the Commissioner. The Undersecretary has made the position clear. There are people, for various reasons, that they do not reach out for help. You ask them, they turn down help. We do not want to just give up on them. People in the database need help, and when emergencies happen, those people will need extra help. So we don't want to rely just on the consent of service users. We want a better mechanism where we have automated processes. In the end, we still have to ask the service user for consent. We cannot just impose the service on them. We want to be able to explain to the person their need and the services we can offer. The hospital authority and the SWD are working well together on patients being discharged. A patient may need help, but that patient refuses to share information with NGOs and welfare organizations. That's where we will need to work on. Now, on what will the future system look like? First, we have to sort out the legal obstacles. What we have in mind is a table. When we implement the system, we will have to link up the system with the records of different organizations. On the best approach forward, we don't want just a centralized system where everyone has to access the system. Different organizations have their own systems. So we want a centralized platform instead. Where the most essential information can come from different organizations and the information is on the future platform. So that's for the system design. on whether we will consider incorporating other forms of data. We have been discussing the possibility with the Water Supplies Department. We've been trying to find out what the smart meters can do. There are pros and cons with each approach, but those options do not give us instant alerts. Say you have no movement in your water meter. Does that mean something has gone wrong with the senior? We cannot tell right away. The coverage of smart water meters remains on the low side at the moment. We have been in talks with the WSD. We're trying to have information that appears to be unrelated to social welfare. We're exploring whether we can rely on such information to help us. So we're still exploring this. It's at an early stage. Next, Mr. Rincon, 4 minutes. Thank you. I have never estimated the difficulty of the task. I'm a lawyer, I get it. Compiling a list is not going to make any difference per se. I'm thinking, say we find a way to bypass the PDPO. That cannot be done. It's a complex task. We're talking about systems. We have a legal system and you also have a database. The same problems remain, whether it's a system for PWDs or high-risk carers. I know the government is committed. I know the government is trying to resolve problems. So let's get the system right so that users are confident in the system. I don't want to force the government to show us something only to find a list that does nothing. We would like to see quality work. Information that should be protected can mean many things. So we have to define what sensitive information is, and we have to find out who we are sharing the information with. Otherwise, all your work would be futile. Once you create a database, a duty arises. Say the hospital authority has to check against the database when someone is admitted. And when someone accesses the privileged information, that also means a duty on the person who has the power to use or access the information. So that's a legal problem to sort out. You will end up in trouble if you create power without duty. Now, on information management. Once you have the list, who will manage the list? Who will have access? Who can modify? Who can delete the information? In other countries, when they have some sort of similar tables or lists, there are reportable incidents. I'm saying all these because I'm inviting the government to check out the Aged Care Act 2024. That act went through third reading in Australia last year. There are hundreds of pages in that act setting out what I just said, protected information. There are provisions on information management. The provisions set out who's responsible, who has a duty. We can learn from that. I'm not saying we replicate something just as complex, but we can look at that as a start. Any response? Commissioner. Thank you. Ms. Kong has provided helpful information. We're all eager to see results, so we want to stay within the framework of the Personal Privacy or Data Ordinance. Now, if there are things we want to do and that is prevented by the current PDPO, we will have to think of something else. So that concludes the first part. I thank the government officials joining us. Now we move on to the next item. We will invite the officials for the next item to join us.
Agenda item 2, measures to encourage and facilitate the participation of persons with disabilities in cultural, recreational, and sports activities. From the government, we have Ms. Winnie Choi, Deputy Director of Leisure and Cultural Services, Ms. Connie Lee, Chief Manager, Festivals and Audience Development from the LCSD, Ms. Candy Nip, Principal Assistant Secretary, Sports and Recreation from the CSTB, and Mr. Kenneth Director, External Affairs from the West Kowloon Cultural District Authority. Welcome. Members who wish to speak, please press the Request to Speak button. I now invite Ms. Winnie Choi, Deputy Director, to walk us through the paper, LC paper number CB bracket 1700/2025 bracket 02. Ms. Choi, please. Thank you, Madam Chair. I thank the subcommittee for giving us the opportunity to report to members on the measures and support we provide to PWDs. On arts and cultural activities, we have 4 types of measures. First, we co-organize cultural programs with arts groups engaging artists with disabilities. Second, we provide funding support to arts organizations with members with disabilities to organize cultural programs. This is to serve the needs of PWDs. Thirdly, we provide special facilities and services at the LCSD's cultural venues to assist PWDs to participate in and appreciate arts. We raised a few examples in the paper. For example, in respect of museums, we organize activities such as the Stargaze Camp for All and the Blind. We disseminate astronomy knowledge in the event. We gave the opportunity for PWDs to mingle with each other. We also have an exhibition called The Great Unity Civilization of the Qin and Han Dynasties in Shanxi Province for participants with hearing and visual impairments. In public libraries, there are specific tools as well as assistive software for people in need so that they can get the information they need. We also seek to upgrade our venues to enhance the accessibility services to allow PWDs to take part in different kinds of activities and events. On recreational and sports activities, we also have a number of facilities and measures. We offer a half-rate discount to PWDs to use our venues. We allow PWDs to bring along a family member or a carer who also get to enjoy the concessionary rate. Also, we give priority to certain groups and organizations to use our venues so that they can hold activities to meet the needs of PWDs. We offer direct subsidy, or we subsidize organizations to organize different activities. We work with different special schools which provide direct training to students. They also organize fun days, for example, to allow students to try different sports. We also have a training program for PWDs. We have over 100 items under the scheme this year. There are training programs in all 18 districts for PWDs. In terms of arts and culture, we also seek to upgrade the relevant venues. There's a lot of work to be done. Say, for example, there are venues that were built before the legislation took effect. We have to upgrade them. We've also listened to views given by PWDs and the relevant organizations. In future, when there are new venues, we will incorporate their views to upgrade the venues. On tourism, there are some popular tourist attractions, including themed parks in Hong Kong. There are facilitating measures in these attractions for PWDs so that when PWDs are having fun in these attractions, they can have a good experience. There are wheelchair rentals as well as designated viewing areas in these attractions, which ensure a better experience for PWDs. That's all from me. Thank you, Ms. Choi. 4 members have asked to speak. 4 minutes for each member, questions and answers inclusive. Dr. Teck Shi Yun, please. Thank you, Madam Chair. Sports and recreational, as well as arts and cultural activities, they involve a lot of different government departments. I'm not sure if the government officials attending this item today will be able to address my questions. I am more concerned about accessibility for PWDs. I was told by PWDs that they have doubts about whether the existing system can help them take part in different activities in events. There are such systems in place, but are they user-friendly? Oftentimes, they have to go a long way, for example, to take the lift if they're in wheelchairs. There is a universal design proposed by the UN. I want to know for large-scale facilities in Hong Kong, such as the Kai Tak Sports Park as well as the West Kowloon Cultural District, are you adopting this universal design framework proposed by the UN to facilitate PWDs? Do you adopt the universal design concept as you assess the barrier-free facilities? Also, I think there is a lack of support. There have been many sports events held by the government. There are very few sign language interpretation for this kind of information. Can you ask the RTHK to provide sign language interpretation? Can you ensure that there is such interpretation service for all kinds of recreational and sports activities? Do you have any thoughts about working on this? Also, we may not always understand the difficulties of PWDs. In terms of provision of facilities and accessibility services, do you have a mechanism in place to allow PWDs to voice their opinions? Deputy Director, I thank the member for the suggestions and comments. We may not be able to speak on behalf on the Architectural Services Department or the Housing Department on whether we are adopting the universal design approach. Under the CSDB, there is an iconic landmark that is the Kai Tak Sports Park. In terms of the design, we have taken into consideration the needs of different people. As mentioned in the paper, there are parking facilities in the Kai Tak Sports Park. We are adopting a higher standard compared to the standard imposed by the government at the Kai Tak Sports Park. On the point about sign language interpretation, we have been working with the RTHK on a regular basis. There's a lot of airtime dedicated to broadcasting some major events. There's going to be the 15th National Games, and we will communicate with the RTHK and will try to incorporate the members' views. I care about whether PWDs get to voice their opinions. Are there channels for that? The LCSD has some subsidy programs for NSAs, for example. We work with them regularly. Every year when we come up with programs for the following year, we ask them for their feedback. We learn about what kind of events or programs are more popular, and we will put in more resources on those programs. At school level, we've been working with special schools, which have been giving us a lot of feedback as well. We see room for improvement. However, we hope that we have enough resources for that. West Kowloon Cultural District Authority. The WKCDA has been working towards building a barrier-free district. So this concept has been incorporated into our museums and performance venues. We have a dedicated team. In terms of hardware, we work regularly with NGOs or the relevant concern groups. We invite people with special needs, for example, people with disabilities, to visit our venues because we need them to be there to tell us what they need. So in 2016, we set up the team, and in 2018, we came up with the accessibility policies. We followed the design manual, barrier-free access, published by the government, which was published in 2008. We do not just look at the hardware, we also look at the software, we look at information accessibility, and we regularly listen to views from PWDs. Since 2013, we've held some 30 consultation sessions with over 700 participants. We do not only have toilets for PWDs. Say at the Hong Kong Palace Museum, there are special plugs and sockets for people in electric wheelchairs. So we will continue to upgrade our accessibility facilities.
I think the West Kowloon Cultural District has done solid work in engagement. Please keep that up. There are libraries, swimming pools. Those places need to show the same level of engagement and continuous improvement. I appreciate West Kowloon's efforts. Now, on universal design, This matters for all recreational and cultural facilities. No official here can answer my question, so I would like a written reply on how the universal design is reflected in the facilities to improve the quality of facilities. So can our secretariat help out on asking for a reply? Mr. Andrew Lam. I want to write on Dr. Tichy Yuan's questions. The West Kowloon Cultural District has done much in accessibility facilities because they have new infrastructure, so they can put in those features. Now, for the LCSD, at the performance venues, there are barrier-free seats, but that feature is not present in every venue. And when such features are present, the seats are in areas where their vision and their line of sight is blocked because the seat may be too close to the stage. We need a systematic review, and that will bring some sort of improvement. Of course, we cannot assume things will be the same as new facilities. Let's try to think of something for facilities where we don't have a barrier-free seat. We would like to see a comprehensive plan. Now, I turn to funding. There are a number of funding schemes. I've been following up on funding schemes under the budget. Now, there's a Sir David Trent fund for sports. That fund has been around for a long time, so can we have a review of that fund? If that fund is not doing anything, so I think after 2007 or 08, no application has been received. If my information is off, please let me know. That fund, the Sir David Trent Fund for Sports, starting from 2014, no new application has been received. And there's $10 million left in the fund. So let's make good use of that fund. And then there is also another fund. It's about arts development for persons with disabilities. No mention of that in the paper. That fund is still active. Last year, at the 6th round, I think, in the 3rd quarter, close to the 4th quarter of last year, there was the 6th round of applications. Quite a number of applications came in. So my question is, how far do these funds go in making life easier for PWDs? The paper says there are collaboration schemes with artists, etc., and they have funding support. There is government funding too. Much time went into the application, but little money was allocated. Of course, monitoring matters, but that also means constraints in how the money can be spent. So my question is, for these funds, to what extent do these funds accomplish their goals? Ms. Winnie Cho. Now, the Arts Development Fund for PWDs, that fund is run by the Social Welfare Department. So we have to ask the SWD for the information after the meeting about the usage and whether there is room to streamline the approval. Now, for the Sir David Trent Fund, let's see if the Bureau has anything to add. Thank you. On sports, the Hong Kong Sports Institute has been piloting a full-time scheme for athletes with disabilities starting from 2017, and that money comes from the Elite Athletes Fund. In 2019, that arrangement was regularized. So for elite athletes with disabilities, they get their funding support from the Hong Kong Sports Institute. That's why the member is seeing no applications to the Sir David Trench Fund. And when that fund is no longer needed, we will rationalize the fund within the system. So the support is coming from the Elite Athletes Fund. As Dr. Tate was saying, we shouldn't have let the Undersecretary for Labor and Welfare leave the room. Coordination is needed with relevant bureaus. Now I come back to the funding's support for PWDs. I followed up on this matter in particular in the context of the budget this year. The FSTB also committed to following up the matter with each bureau. My focus is making the most of the resources already available. The money is there. Let's review the fund. If the fund is no longer needed, we move that money back to the government account. Let's make the most of the existing resources and do as much as you can in the existing work. Mr. Rincon. We need someone from the LWB here. Otherwise, we end up with a very limited scope. Because much of the matters under discussion here falls under the LWB. We need to show PWD's inclusion in cultural and recreational activities. We need measures and also a strategy, a policy. Those can be found in other places. The LCSD can only tell us about the measures, but the LCSD would be hard-pressed to tell us about the strategy. PWDs have the right to take part in cultural and recreational activities. They shouldn't have to be elite athletes to be able to take part. They should be able to take part in different activities for leisure, as a hobby. We're offering concessionary fares, we offer facilitation. But as a whole, are we really encouraging the participation of PWDs in cultural, sports, and tourism? We can do better. Now, here are my questions. Outside Hong Kong, in some places, they encourage PWDs to take part in sports, culture, and recreation because those places also take mental health seriously. They set up clubs, not fancy clubs, simply social clubs. Those clubs are where PWDs come together. PWDs can access different kinds of activities that work for them. Of course, sometimes people still have to go to a cinema, but there are activities where you can offer tailor-made activities for PWDs. I know this may not be a question that the officials here can answer, but can we set up such social clubs? Can we offer different programs at such social clubs so that PWDs get better at interacting with people and they can build up their networks? Now, I want to turn to people with autism spectrum disorder. They are PWDs. There are performance venues for people with ASD or for people who are particularly sensitive. There is such a kind of relaxed environment. Do we have performance venues in Hong Kong offering a relaxed environment for people either with ASD or people who are just more sensitive? Ms. Winnie Cho. I'll do my best to answer the questions. We do not have a social club for PWDs yet. Starting from 2018, we have been organizing regularized events for PWDs. We have managed to bring together PWDs. Some are taking part in such events over and over. Of course, we're still some distance away from offering all-round care, but we're offering something, and we will continue to work on this. PWDs do get better after taking part in our events. Now on performance venues, Ms. Connie Lee. On performances, now we have the International Carnival for PWDs, and then there are also relaxed performances. Last year, we had a dance troupe from Sweden. We invited primary and kindergarten students to join the event where we offered an relaxed environment. This year, we will also offer such relaxed environment with the International Art Carnival. There will also be a relaxed environment at a Mulan performance. There will be something not just for conventional PWDs, but also for people with ASD. There will be performances for them. There are summer programs, say movie screenings for children. There will be something special with the lighting so that those children can enjoy the programs with their families. And there are also renovated facilities at Saiwan Hall and City Hall. There will be quiet rooms. We'll try to give support when there are performances. Anything to add? No. Mr. Ng. Now, on this point for the West Kowloon Cultural District, indeed, as Ms. Kong said, PWDs have the right to take part in sports, cultural and recreational events, and that's good for their well-being. I have covered the hardware. Now, for software, we try to incorporate different elements as those mentioned by the LCSD. At our museums, there are guided tours for people with different needs. There are performances where we engage PWDs on relaxed performances. Over the past 3 years, we have launched an inclusive community engagement program. For a relaxed program, you need vast resources to make that happen. Other places may have their standards. Say, out of 10 performances, a certain percentage of those performances have to be relaxed performances. You need those performances for people with special needs, but then you have to consider the revenue and the resources. We try to incorporate these elements. We don't have a hard and fast target. We have funding from the Yaoqing district office so that each year we have 2 to 3 relaxed performances where people with different needs can take part. These are people with visual or hearing impairment. We offer sign language interpretation. There are people suffering from ASD. There are ways for them to take part in these events. Different forms of support are needed in the venue. We don't have a silent room in the Xizhi Center yet. We have to build a temporary silent room for those people. That's why resources are needed. But after we try this out, we find this is very meaningful. More 4,000 people took part over the past 3 years. This year, 1,500 people took part. 60% of them were PWDs. The point is inclusiveness. We want PWDs and their carers to be able to take part. On hardware, In 2026, there will be a lyric complex. We will try to set up a silent room at that complex so that people who are more sensitive can take a break in such silent rooms.
Next, Mr. Dennis Leung. I declare that I'm a registered coach under the LCSD. The LCSD offers a lot of training programs for PWDs. I taught some PWDs how to swim. I think these are great programs because it allowed PWDs to learn how to swim. Every year in all 18 districts in Hong Kong, there are sports competitions held by the LCSD for abled people. There are very few competitions dedicated to PWDs. In some countries, in competitions for abled people, there are sometimes items that include PWDs. Will the LCSD follow suit so that we can promote social inclusion in this respect? According to paragraph 14 of the paper, it is said that the LCSD has been working with different NSAs to organize activities. But we only have figures for 2024 to 25. 100 training courses were organized with more than 1,200 PWDs participating. Can the administration offer statistics for the past 3 years so that we can see the situation with the supply and demand so that we LegCo members can review how we can do more for PWDs in the future. This is the purpose why we're having this meeting today. We need more information. Ms. Winnie Choi. Mr. Leung is very familiar with our programs in all 18 districts. We have some very popular sports competitions. We do not have enough manpower or even participants for holding competitions for PWDs. We are holding training programs, say for boccia. It's for both abled and disabled. Say boccia competitions could be very popular. We will see how popular the programs are. In the 9th Hong Kong game yesterday, we tried to introduce items for PWDs. For example, we had the wheelchair 3-on-3 basketball competition. We also had boccia competition, and there was great participation, and we will continue with our effort. We will hold training programs, fun days, and apart from that, we'll also hold more competitions to enhance the ability of PWDs. We've heard the members' views. We will look for the relevant statistics. We will look for the information about the supply or provision of programs for PWDs. Madam Chair, I know that people need to provide their address before they sign up for a competition. Say I live in Tuen Mun and I sign up for competitions in Tuen Mun and I get the priority to do so. If I live in Tuen Wan, I don't get the priority. For PWDs who want to take part in these competitions, can you exempt them from providing the address and deciding on the priority based on their address? We want to have more sports competitions for PWDs. These could be incorporated in competitions for abled people. This could help save resources. I hope the LCSD would take into consideration my suggestion. Administration, we will consider this. We ask people to provide their addresses when they take part in the Hong Kong game, for example. We will definitely review our existing mechanism. Ms. Lillian Kwok. I know the venues under the SUSD have been improved, including the accessible facilities. People with hearing or visual impairments could also make use of these venues now. I have some suggestions. The government has been training some audio descriptors so that they can offer audio descriptions for PWDs who take part in screenings or in theater shows. Can we make use of AI instead? Can AI offer audio descriptions so that we don't need human audio descriptors? Can such services be offered to people with visual impairments? Also, you have considered the needs of people with ASD. They are more sensitive than abled people. I've brought students with ASD to some theater or drama shows. I've also brought them to some inclusive performances or movie screenings. They are scared of sudden changes in environment. Can there be special screenings or performances so that lights will not be switched off entirely? Can such an option be offered to those in need so that there won't be emotional distress on their side because of the sudden change in environment, and that parents could bring them to those performances? Also, you've been providing barrier-free access facilities. However, I noticed a problem. People cannot access those facilities. Take the Kai Tak Sports Park as an example. There are barrier-free facilities, but some people, they don't have access to them. Some seniors in wheelchairs, it takes them 30 or 40 minutes to get to the barrier-free facilities because of unclear signage. Also, there isn't a point for them to get off, for example. In the Hong Kong Coliseum as well, PWDs do not have easy access to the barrier-free facilities. Can there be cross-bureau or cross-departmental collaboration so that accessibility can be enhanced for PWDs and that they could take part in mega events? Ms. Winnie Cho. The first 2 points are about the environment in movie screenings. I'll reflect the views to CCIDA, the Cultural and Creative Industries Development Agency, because it seems like a doable idea. On the facilities at the Kai Tak Sports Park, again, will reflect the opinions. Apart from wheelchair users and seniors, we've got feedback from other people as well, and we will consider all these views in one go. Also, we will continue to review the barrier-free access facilities to see how we can encourage the participation of PWDs in cultural and arts activities. Just now it is mentioned that there are training programs for PWDs. Some PWDs are more sensitive, and some of them are highly talented in arts. There are AI-generated movies and short videos, for example. Can there be training in this regard so that PWDs can enjoy arts and culture more? Also, can you ensure that PWDs can have access to your barrier-free facilities? Please take this into consideration when there are mega events. Any reply, Ms. Choi? We can make use of AI. We offer training programs to PWDs, and we talk to the arts groups that offer such training programs on how the programs should be held. So we will talk to these arts groups to see how we can make use of technology so that we can embrace the opportunities brought by technologies. Now it's my turn. We want to promote measures and facilities that are friendly to PWDs. I think PWDs should enjoy equal opportunities in terms of taking part in arts and cultural activities. Now I'd like to ask about the sports subvention scheme for PWDs. In year 2024 to 25, $35 million were allocated to NSAIDs for organizing activities for PWDs, but there is no publicly available information on how the money was used. What kind of activities were held with the funding? And what was the participation rate? And how satisfied were PWDs with these programs? How could the government make use of funding in future to ensure the sports development of PWDs? Now turning to venues under LCSD, there are more public spaces that allow easier access to barrier-free facilities for PWDs. There are 105 sports venues or recreational venues for PWDs, but only 6 of them give priority to PWDs for making booking during non-peak hours. And this may clash with the rehabilitation hours for PWDs. Will the LCSD open up more sports venues for PWDs to make bookings? Organizations and groups with PWDs, they often have to look for venues. They've been having a hard time to look for such venues. For those who engaged in boccia, it's been hard for them to look for the right venue. Sometimes they have to hold competitions in universities. How can the government support PWDs in holding more sports events? We have the national games coming up. We hope PWDs could unleash their potential and talent and take part in different sports events. I want to know if the LCSD have a long-term plan to encourage PWDs to take part in arts and sports activities.
Now, first, the Sports Development Fund for PWDs or athletes with disabilities. Just like the case with the Arts Development Fund, this fund is managed by the SWD. So after the meeting, we'll have to consult the SWD about this. Now, on sports venues, as the paper says, there are 6 venues offering priority access to groups of PWDs. We have to look at the usage and the hours, whether those 6 venues are enough. We will find out from those groups of PWDs where they would like to see an expansion of the scheme. We do annual reviews on this matter. People from all walks of life have told us that our venues are in huge demand. That's good. That shows people exercise regularly. So we have to strike a balance when it comes to giving priority access. We don't want to make the venues harder to access for people. We're pleased to see the keen demand from persons with disabilities for these venues. Now, on making it easier for people to secure a venue, we have the Smart Play app. There's the app, there's the website for Smart Play. The user can pick the district and then indicate the facilities they want. Or they can start with the facilities they want, and then they can see where a venue is available for, say, bocce. Or people can simply narrow down the search to Kowloon or to particular slots over weekends. The app can help the user find a facility that works for them at a time that works for them. So let's make greater use of Smart Play. People will be able to find unbooked slots for the next 7 days on Smart Play. I hope that answers the questions from the Madam Chair. There are vulnerable groups in the community. Of course, everyone wants priority for themselves for access to venues, but for the disadvantaged, they deserve extra attention. That's why we have set up this subcommittee, and we have an agenda item on cultural, recreational, and sports venues. So can the departments come up with an item for the hundreds of thousands of PWDs in Hong Kong? Thank you. Does any other member wish to speak? If not, that concludes the second item. Any other business? Now, this is the last meeting of this subcommittee. I thank the LCSD, the CSTB, and the West Kowloon Cultural District. Now, starting from last June, this subcommittee has held 8 meetings, including 1 deputational hearing on support services and planning for PWDs. I thank all government departments and members for taking an active part in the process. Now, any other business for members? If not, that concludes the meeting. Meeting's adjourned. Thank you.